Post-traumatic stress disorder is a mental health condition that is triggered after a person has witnessed or experienced a traumatic event such as military combat, assault such as being raped, or a serious accident. PTSD cannot be diagnosed until 1 month has passed after the traumatic event has occurred. If no physical illness is present, the patient will be referred to a mental health professional, which will make an assessment based on the symptoms and determine the diagnosis.
Who goes into the military? Currently, Black women are enlisting at far higher rates than white or Hispanic women. In addition, Black women represent a third of all women enlisted. This is twice their percentage in the civil population. This is as opposed to Black men who represent 16%, which is similar to their civilian population. 70% of military recruits have a high school education. Many officials have admitted to lowering their expectations to receive higher numbers of recruits and are recruiting people without a high school education. The people most likely to join the military are those classified as low socioeconomic status and the people who choose to pursue social mobility.
My grandfather was in World War II, so he was a soldier. My dad was in Vietnam. He was a soldier. So it was always my dream to become a soldier.
The choice to enlist in the Army is a life-changing decision that many men and women have made since its formation in April 1775. While it's a rewarding adventure, there are restrictions to expect, such as time commitment. These are the pros to joining the military. Free college. If you can't afford college and don't want to have those horrible student loans hanging over your head, then the military is a good way to go. Benefits. In the military, you will receive benefits such as a paid vacation, free healthcare, and a set retirement plan. Guaranteed paycheck, free rent, and utilities. Nobody ever became a millionaire by joining the military, but you can always take pleasure in the fact that no matter what, that check will always show up in your account the 1st and the 15th of every month. They will pay for your rent and give you a set amount of money to cover utilities, and if you don't use 100% of that utility money, you get to keep the rest. One of the cons of joining the military is that you cannot quit. Although there are ways to get out early, most of them involve jail time or a dishonorable discharge, two things many do not want. Being far away from friends and family. Being stationed in another part of the world can be a big wreck at times. You'll miss a lot of birthday, holidays, weddings, births, and even funerals. It is potentially dangerous. Recruits for the Army face the danger of going into combat. If sent to combat and are injured, it can be a struggle to deal with long-term physical limitations. The aftermath of battle is often difficult emotionally, leaving many soldiers suffering from depression or post-traumatic stress.
When military personnel are deployed, they have a very limited amount of choices as to what they choose to consume. For many years, there were fast food chains available to soldiers at the military bases. For a little while they were banned, then they sprung back into action. A vast majority of soldiers would choose to eat fast food when on base for the sake of having a little taste of being back home. However, the constant intake of fried foods is detrimental to their health. When not on base, they are given meals ready to eat, more commonly referred to as MREs. MREs are intended for healthy and active individuals, however, are only recommended to be used as a sole source of nutrition for 21 consecutive days only. Without meeting these requirements, a person's risk of developing heart failure increases. Troops that are deployed and not on the field are constantly exposed to toxicants. Toxicants that can severely affect their health and their performance. The toxicants they're exposed to can be industrial and environmental toxicants, combat material, and a wide range of physiological stressors. When not at combat, the many chemicals and metals our military personnel are exposed to can have a harmful effect and toxic effect when inhaled.
Burn pits. I don't know if you've ever heard of a burn pit, but we burned all our garbage. So there was a big area where we just went and threw all our trash, and it was burning all the time. In 2005, we were near oil refineries, and they would get blown up. So we would get the fumes from the
oil refinery blown. Oh, I see.
If it's not the deficiency of nutrients in the military diet or the constant exposure to a variety of toxicants, what may have a significant effect on the health of soldiers is a prolonged exposure to high cortisol levels. In translation, the exposure to stress all hours of the day is detrimental for the health of anyone and can have an impact on physiological processes taking place within our brains. Prolonged exposures to high concentrations of cortisol released through the HPA axis pathway in response to stress stimuli can have the effect of decreasing the overall size of the brain and causing the ventricular spaces to enlarge and become asymmetrical. It can also cause increased activity in the amygdala, the part of the brain associated with fear, and decreased activity in the hippocampus, the part of the brain associated with learning, memory, and stress control, causing the victim to lose the ability to control their stress. Troops deployed are the most susceptible to these prolonged high exposures to stress and are the ones the most affected.
After talking about all the intense changes people go through once they go into the military and combat, it is no surprise that many veterans suffer PTSD. The problem with PTSD is that most people don't know they suffer from it until it may be too late. People around them may not notice either, and they are exposed to the dangers this ailment brings with it. Some of the general dangerous behaviors that a person with PTSD might present are addiction, violence, and suicide. Having gone through so much, many veterans seek refuge in drugs or alcohol once they return home. According to the U.S. Department of Veteran Affairs, even if someone does not have a problem with alcohol before a traumatic event, getting PTSD increases the risk that he or she will develop a drinking or drug problem. This means PTSD and substance use disorder, or SUD, are very much correlated. The department also delivers the following statistics. More than 2 of 10 veterans with PTSD also have SUD. Veterans with PTSD and alcohol problems tend to be binge drinkers. Binges may be in response to bad memories of combat trauma. Almost 1 out of every 3 veterans seeking treatment for SUD also has PTSD. The number of veterans who smoke is almost double for those with PTSD versus those without a PTSD diagnosis. In the wars in Iraq and Afghanistan, about 1 in 10 returning soldiers seen in VA have a problem with alcohol or drugs. After looking at these facts and numbers, it is no surprise that some PTSD victims also become violent. While victims with PTSD are not considered violent, PTSD does increase the risk of becoming violent. Until now, there is a conclusion that victims with PTSD and SUD are more likely to become violent, unlike victims who suffer solely of PTSD. Having analyzed all this data, suicide in veterans with PTSD becomes more likely to occur once they have returned. It is very difficult to get statistics in regards to suicide rates because some states do not have to report deaths to a higher power. But from the data we have in our reach, we have found the following. From 1999 to 2010, the suicide rate in the U.S. population among males was 19.4 per 100,000 compared to 4.9 per 100,000 in females. Based on the most recent data available in fiscal year 2009, the suicide rate among male veteran VA users was 38.3 per 100,000 compared to 12.8 per 100,000 in females. This alarming peak in numbers makes us realize that PTSD is really a big factor in regards to suicide rates, and that veterans just can't cope with what they have experienced in their years of traumatic service. There needs to be a way to be able to fix this.
PTSD is not only affecting the individual, but anyone around them, especially family. When it comes to family, several different things can go. Sympathy is the usual first reaction from family members to the loved one. Even though sympathy helps the loved one to overcome the situation, it can also result in send out of tiny wrong messages that tell the individual with PTSD that they have low expectations for him. It's hard when a family member is suffering from any kind of disease, injury, or illness. When a family member suffers from PTSD, common reactions can be feeling depressed, fear, and worry. Depression can come to a family member after trying to help the loved one with no good results. Fear and worry can be transmitted from the PTSD victim to the family, since they can persuade their kids and their partner that they are in a constant danger. Guilt and shame are an extension of depression in traumatic events. Feeling depressed for not being able to help the PTSD victim can easily transform into guilt and shame, since the family members are supposed to protect the family, meaning that family members blame themselves for the situation that PTSD victims are going through. The lack of empathy can result in anger. Family can have hard time understanding that PTSD is real and sometimes feel like they should just get over it and go on with life. It's common in the absence of empathy, but also after several years of trying to help the victim. All the previously mentioned emotions can happen to PTSD family members. and can easily result in health issues. Bad habits, too much stress, plus any other already existing problems that family have to deal with. The government of the United States offers over 200 specialized treatment programs for PTSD victims, for veterans. We see activity from the government, but it's important to make a note that many of the services out there for PTSD victims are offered for veterans only. It's an important point since socially it throws out a wrong nationalistic message saying not only the veterans deserve more benefits, but also that outside of war events, other traumatic events are not as important or real.
Some reports indicate that 70% of adults in the US have experienced some type of traumatic event at least once in their lives. This equates to approximately 223.4 million people. Up to 20% of these people go on to develop PTSD. As of today, that equates to approximately 44.7 million people who were or are struggling with PTSD. An estimated 8% of America's 24.4 million people have PTSD at any given time. That is equal to the total population of Texas. An estimated 1 out of every 9 women develops PTSD, making them about twice as likely to get PTSD compared to men.
The 5 most common therapies are the following. Individual psychotherapy is a weekly one-to-one meetings with a licensed psychologist, social worker, or mental health counselor. Cognitive behavioral therapy puts an emphasis on thoughts, feelings, and behaviors. It focuses on changing the triggering stimuli and desensitize the negative response. Eye movement, desensitization, and reprocessing, EMDR. Practices are the activation of current thoughts, feelings, sensations, and beliefs. The goal is to help the person change to a healthy and more accurate set of beliefs. Group therapy is a supportive environment where experiences can be shared with others. This works as a social support for the patient. The 5th form of treatment are medications. There are different types of drugs that can help regulate the neurochemistry affected by a traumatic event. Those include anxiolytic medications or anti-anxiety, antidepressants, and adrenergic agents to lower the arousal levels. Fort Bliss is a United States Army post in New Mexico and Texas, with its headquarters located at El Paso, Texas. With an area of about 1,700 square miles, it is the Army's second largest installation behind the adjacent White Sands Missile Range. As of 2005, the base contributed about $1.7 billion to the economy of the Central El Paso and Northeast El Paso, and many businesses in the region serve as post troops. The influx of troops from the 1st Armored Division in 2011 led to a housing and schools construction boom in the central and northeast areas of El Paso. As of the census of 2000, there were 8,264 people, 1,527 households, 1,444 families residing on the post. The population density was 1,340 people per square mile. There were 2,300 housing units at the average density of 374 square miles. The racial makeup of the post was 58% white, 25% African American, 2.4% Asian, 1.3% Native American, 0.7% Pacific Islander, 8.9% from other races, and 3.5% from 2 or more races. Hispanic, Latino, or any other race were 19.3% of the population. In the summer 2014, it was reported that Fort Bliss Veterans Affairs Clinic had one of the longest waiting times in the U.S., with an average wait time of 60 days to see a medical professional. During this time, it was noted by Congressman Beto O'Rourke that El Paso VA Clinic had 5 open spots for medical health professionals that had yet to be filled, despite the fact that Fort Bliss has approximately 40,000 soldiers stationed at the base. Restoration and Resilience Center at Fort Bliss was established in 2005 by Dr. John Fortunato, a Vietnam War veteran. Benedictine monk, a clinical psychologist who was instrumental in founding the center, and was succeeded by Vicky Thomas, PhD. Currently, treatments from the Eastern Hemisphere include Reiki, acupuncture, and massage therapy. Thomas emphasizes that Eastern medicine is neither new or unresearched. Thomas recommends group therapy as an effective means of combating the invisible wounds of the battle. Post-traumatic stress disorder can make a soldier feel very alone, very confused, said Thomas. But when they are in a room full of other soldiers and see an NCO, they look up to and respect going through the same thing. It makes it more acceptable. More importantly, it makes it more understandable. Group is so powerful, she said.
I think it had to have been a lot of things. Because before I went to Iraq, my first tour, I was happy all the time. It took a lot to get me angry. And afterwards, I got angry really fast. And I think while I was in a vehicle explosion, my vehicle was hit by a roadside bomb. So that was part of it. We got rocket attacks from the enemy every day. Morning, lunchtime, night, all the time. It was a lot. And you're always on guard. You never feel safe, Even if you're in your base and at bed at nighttime, you still don't feel safe because there's always the possibility of something happening. So I think when you come home, you still feel that. You had it every day for a year, so it's hard to lose that feeling, that something's always there. So myself, personal therapy where you get to talk about your feelings and what you're going through, that helped me a lot. My wife and kids, they didn't really understand what I was talking about. The individual counseling, being able to talk to somebody and letting it out without being judged, that helped me a lot.
What advice would you give to adolescents that want to join the military, knowing that PTSD is something that can happen to them?
If you're gonna do it, which I would think it was the best time of my life, being in the military. I enjoyed it. When I retired, it took a lot out of me. Seek help early is what I would say. If you're feeling different, weird, get help early. Don't be a tough guy and try to do it yourself.